Hello and welcome to Labour Lens. I am Sharon Ijason. On this week edition of the program, we'll be focusing on workers in the healthcare sector and the quest by the federal government to concession hospitals across the country. We will be right back. The Court of Appeal in Abuja Division has ordered members of the Academic Staff Union of Universities, ASU, to resume work with immediate effect. The appeal court gave the order in a ruling on an application by ASU seeking permission for it to appeal against the order of the National Industrial Court, which asked the striking lecturers to resume duty.
So the Honorable Court granted them a conditional leave to appeal, provided today they must obey the order of the National Industrial Court made on the 21st of September, ordering them to return to classroom. You heard the court considering the interest of students who had been locked out of school and educational infrastructure that had been locked down for the past 8 months, and saying that order of the National Industrial Court must be obeyed today, and upon proof of compliance of that order, they can file a notice of appeal. We had made the point that there was no appeal before this court.
In 2016, crisis broke out among members of the Academic Staff Union of Universities. For 2 years, the bone of contention within the ranks of the union was intractable. The Breakaway Group accused ASU leadership of misappropriation of funds and eventually applied to be registered as a full-fledged union of university teachers. The Congress of Nigerian University Academy believes it met all the criteria for registration and did not see why it should be denied recognition.
While we are standing, please we will take the second stanza of the national anthem as our opening prayer.
The prolonged ASU strike, now in its 8th month, provides an opportunity for the federal government to break the ranks of the academic staff.
We are going next to present you your registration letters.
Labour and Employment Minister presents the certificate of registration to Konwa. Chris Ngige says the committee set up to look into the association's request had recommended its approval since 2020. The government also issued a certificate of registration to another breakaway medical group within the university system, the Nigerian Association and Dental Lecturers in Academic, NAMDA.
A legal union of workers with rights and privileges. And there is no discussion that will take place in any university academic environment for academic workers, of which they are members, that will not involve them. Any discussion where ASU is invited, they should also be invited.
The two newly registered unions say strike is not the only route to resolving industrial disputes.
With this registration, a platform has been created for medical trainers/teachers to start the process of gradual reversal to the known normal medical training environment that was punctured in the early 2000s.
We are giving the assurance that we will work to ensure that this country, Nigeria, is not traumatized again by academic union dislocations in the country's public universities.
The minister said allegations of non-rendering of audited accounts by ASU since 2017 is being investigated by a special committee of the ministry headed by the permanent secretary. He said it is after then that the Registrar of Trade Unions will take appropriate actions to preserve the integrity of Nigeria's labor administration system.
The Education Writers Association of Nigeria, A1, with the support of the Lagos State government, has concluded arrangements to hold an education summit tagged Towards Safe Schools in Nigeria. The summit is scheduled to hold on the 12th of October 2022 in Lagos. Chairman of the association, Mojid Alabi, in a brief interview says the summit is aimed at proffering solutions to the barrage of attacks on schools, most especially in the northern part of Nigeria. Chairman of the association, Mojid Alabi, in a brief interview, says the summit is aimed at proffering solutions to the barrage of attacks on schools, especially in the northern part of Nigeria.
Just recently, UNESCO reported that the number of out-of-school children in Nigeria has grown to 20 million plus. This is very critical. It shows that the country is sitting on a keg of gunpowder. You have 10 teachers that have been killed within the last 10 months. So this is quite important for us as key stakeholders within the nation's education sector to advance conversations around how schools in Nigeria can be safe. And safety is not only about physical attacks. We also talk about drug abuse in schools. We talk about health safety. We saw what we experienced when we had Ebola outbreak and COVID-19 outbreaks. There is drug abuse, there is violent courtesan, there is rape, there is bullying. All these are part of the challenges within the education sector, and we need to tackle them head-long.
Civil servants from various ministries gathered outside of the head of service office, Alausa, for the arrival of Governor Babajide Sanwo-Olu. It was a rousing welcome. The governor is here to appreciate the workforce behind this vision. Describing the civil servants as the success of every administration, Governor Sanwo-Olu says they should be encouraged starting from their take-home.
Put your hands together for Mr. Governor. As a country, there is high level of inflation. I know that as a country, there is high cost of living. Last month, I instructed at a cabinet meeting, the head of service office and the Minister of Staff, Training and Pension to start work on how we're going to increase the entire salary of the public service.
Apart from the salary increment, the governor also disclosed that the first phase of the distribution of official cars will commence.
I'm aware that you still want a few more buses to create new routes. Abi? Okay, I'll work it out with the head of service. Before the end of this month, we'll see the number that we need to bring in. We'll start with a brand new 100 vehicles for our directors before the end of this month. So we'll start doing it in phases like that.
This face-to-face engagement has always been Governor Babajide Sanwo-Olu's style to motivate and rededicate workers to service and have absolute commitment to the development agenda of his government.
The Petroleum and Natural Gas Senior Staff Association of Nigeria, PENGASEN, is set to hold an Energy and Labour Summit tagged PENGASEN Week. The national president of the union, Festus Osifo, said the event is a maiden edition with the theme Energy Transition and how it will impact the world of work. In an interview, Osifo emphasized the need for synergy among industry players as the world transits to clean energy sources. The event is scheduled to take place between 17th and 19th of October.
We came up with it after some of the organs meeting we had. We felt that there are topical issues in the industry that we need to put in the front burner. Today we are talking about energy transition, for example, and energy. Nobody is talking about the impact of energy transition on the workforce. All we are talking about is climate change. All we are talking about is that we are going to face our fossil fuel in the next few years. But no emphasis are alluded to the fact that workers may lose their jobs, or the fact that we need to start doing some level of training in order for our members to be able to fit into the new realities that may come in the next few years.
drain is actually affecting all sectors at the moment, pharmacists, nurses, doctors inclusive, and on a daily basis, a lot of people are moving. And even those that you can still see around for now, a lot of them are actually planning to move. So it's really bad. And you realize that in many hospitals now, for example, you are not likely to find specialists anymore. Endocrinologists are very few, cardiologists almost not even existent, and all of that. And so it's actually scary. It's scary for the populace. So if someone falls ill now, what's the probability of that person living? You know, the probability of that person to die is actually very high. I'm using the opportunity, you know, to call on the government to I don't know, if I'm going to give my own suggestions, make the working environment conducive for health workers to remain. I'll leave that to you, to their discretion, you know, to know what to do. But it could be in a place of welfare. It could be, you know, just generally working environment. I won't lie to you. Like I said earlier, even those that have not left are planning to move. So honestly, I can't say I really know the way forward, but I hope that the government can do something about it.
The system is not working, it's not providing the conducive environment for them to perform. And as a human beings, it's natural for human beings to gravitate or migrate to where they have better environment to provide the services. I mean, it's natural. So they have enough satisfaction for the services they are providing. You know, it's very natural. So what am I talking about? I'm saying that if the right system is in place, if the conducive environment is in place, what don't we have in Nigeria? We have the population. Population are people requiring these services. You know, and as business people, we want to look at it from a business perspective. We need to be where the population is. So why are people moving from that place to some other place? Because some things are not right. My perspective about this is this: if you are concessioning, it should not be everything, and it should be facial. It should be gradual. You follow? There are a lot of things, services that are offered in these facilities. So we should map them out, put timelines on them when one will be concession to the other. Why are people talking about concession? It's just because the public hospitals are not performing. There are a lot of things you expect you don't get. The quality services are not there. When anybody comes for a service to any place or in any place, what they demand is service, good service, quality service. See, if they are not getting it from the public hospital, it's natural they would want to get it anywhere. Call it private hospital, call it anywhere.
Well, from experience, you know, not because I'm the private sector do better than the public sector. In most cases, not only hospital. You know, we have seen from our telecommunications in those days when NITE were handling it, you could see what happened. Same thing with Night Post and so many things. I don't want to say public sector, you know, there is no, I don't know if they appraise them, their performances. So they do anyhow. At the end of the month, you know, the salary will come in. But private sector, there is no way you can mess up what you are doing. You are rated, you are appraised regularly to deliver what you are being employed for. So there are better monitoring, better appraiser at the private sector. And unlike public sector where there will be sentiments, you know, somebody somewhere in government that can make you to a particular post where maybe you are not even supposed to be there. Private sector, they deal with what they see. The results is result oriented compared to what the public sector is now. So if public hospitals were given such opportunity, I think they would do better. From services from every professional to even the management. Nobody will just sit and fold their hands. They know they have to deliver. There will be results expected from them regularly.
On the profile interview segment this week, I'll be speaking with the Secretary General of the Medical and Health Workers Union of Nigeria. He brought us up to speed on how workers in the sector are faring. the need for the federal government to stop the idea of concessioning of public hospitals, and also the reason why there's massive brain drain in the healthcare sector. We will be right back. It's good to have you on the program.
Thank you very much, and you're welcome.
A lot is happening in the health care sector. Can you bring us up to speed on what the Medical and Health Workers Union position is when it comes to the issue of hospital concession, which the federal government is looking into recently?
Let me start by saying Medical and Health Workers Union of Nigeria is in strong disagreement with the federal government in respect of tactical privatization of health facilities in the country. You will agree with me that the only thing the common man is benefiting from government nowadays is the healthcare delivery. And in as much as federal government decided to privatize these health facilities, I can tell you it will be above the level of common man in this country. Rider to it, there is a teaching hospital here in Abuja, Gwagwalada Teaching Hospital, which federal government attempted to privatize it. I can say it is now on semi-privatization level. If you go to that health facility trying to access healthcare delivery, you can spend not less than 15,000 naira just for you to access your record, meaning to get a prescription card before even going to see a doctor, talk less of drugs prescription, talk less of other medical attentions. So I think this is a typical example, and this is a typical things that you will agree with me that if government decided to privatize these health facilities, healthcare delivery to a common man will be a history, and it will be above the average Nigerians. So I think Medical and Health Workers Union is doing a lot to kick against this attempted as well as ill-minded initiative by the federal government.
Okay, with this development, how would this affect Nigerian workers apart from Nigerians generally? How would it affect the workspace? If at all this privatization is successful, how would this affect the average Nigerian healthcare worker, if I may ask?
Let me be honest with you, Sharon. Nowadays, if you go to all our health facilities in the country, we even lack manpower. Manpower is in a very serious dilemma. You can see a doctor attending 250 patients per day nowadays. If you go to that issue of acquisition or privatization, I believe in every facilities that have 3 medical doctors, they will slash it to be 1 medical doctor. In a pharmacy where you will see 3 pharmacists working, it will be a single pharmacy. In a laboratory where they have 3 medical laboratory scientists, they will end up having even technician. So if you take a look of the even manpower, it will drastically go down, and it will affect the healthcare delivery system in the country.
Talking about manpower, right now, I don't know if I should use the term, there is a jackpot syndrome. Everybody is running away from the country to seek greener pasture. And the healthcare sector seems to be what is very attractive for everyone that is maybe a nurse, a lab technician, just anything that has to do with the body. You are welcome to Europe or maybe Canada. And I am aware with my interactions with Nigerian workers that we have some states whereby you don't even have doctors. We have some few doctors trying to manage from one teaching hospital to another within a state. It's getting to that point whereby we don't even have some specialists in a particular area in some certain states in the country. As the Secretary General of this union, how would you react to this? What does the government need to put in place to ensure that we retain the best brains? Because the best brains, of course, are already looking out of the country.
Well, I think it's a very good observation you raised. And in response to that, one, government should ensure that adequate provision of facilities or equipments are provided in almost all our hospitals, because you can see a very befitting hospital structure without equipment. So most of our health professionals are running away from the country because there is no equipment. Two, even the package. Yeah, if you go, not even in Euro or developed country, go to Ghana, just Ghana, for example. I was in Ghana just two days ago. I was interacting with my colleague in Ghana, who is a consultant ophthalmologist. If you take a look of his salary compared to here in Nigeria, there is a variation of over 2.3 million to his colleague in Nigeria. So I believe if government will try to probably adjust the package, it will help a lot to reducing our people to be going abroad for maybe practice. Then number two, government should try as much as it can to avoid desegregation among the health care professionals, because you can agree with me, there are almost 1,000 numbers of nurses professionals who run out from this country to other countries just because they have a welfare package. Two, there is no segregation, they are working as a team. Yeah, it is in our slogan that health work is a teamwork. Everybody is considered to be significant and important. So if you go to that countries, it will be difficult for you to even differentiate between medical doctor and the nurse, because they are working collectively as a team. Then number four, government should try as much as they can to do away with thinking maybe they will generate money from health industry. Because if you go to developed countries, government is paying a lot of money without thinking on how it will retrieve that money back. But in nowadays country, in nowadays pattern in our country, government is now trying to come up with an initiative that even the health system will be sell out to our citizens, which I believe it will not augur well, not only to the current administration, but to the well-meaning Nigerians.
Okay, so moving forward, what more can be done to improve the healthcare sector? We agree that the package is actually poor. I know that the health workers have their demands. They've suspended their industrial action at many times. But right now, has there been any engagement with government in terms of ensuring that the welfare of workers in the medical and health sector is being prioritized?
I'm sorry to use this word. Government, particularly the Federal Ministry of Health and the Federal Ministry of Labor, are not sincere to us. And they are not justice to us. It will be unfortunate to inform you that we suspended our strike without any tentative responses from the government. We just have the interests of common man in our heart. That's why we decided to suspend that industrial action. As a health professional, we believe our first priority is patient. The second priority is patient. Even the third priority is patient. So that's why we decided to suspend that industrial action. But if you are to think of the commitment from the government, I can tell you it's very disappointing and it's very worrisome. So government should do everything possibly, more especially to these two ministries, because to me, they are Ministry of Doctors. They don't consider other health professionals as even health workers. What they are more doing is they are giving more priority, they are more concerned to the medical doctors, which is quite very, very unfortunate compared to other developed countries. Let me give you this context of the United States of America. The chief surgeon of the United States of America currently is a nurse. They do away with professional differences. So I think Nigeria must start somewhere to address this issue of professional barriers or professional discrepancies, in as much as we wanted to have a very effective, efficient and affordable health system in Nigeria.
Okay. We understand that the patient to medical personnel ratio is actually not encouraging. We have more health workers attending to a large number of patients, and the infrastructure isn't there.
what will be your message to relevant stakeholders in terms of probably employing more people into the system, paying them well, and also ensuring that we have up-to-date medical facilities so that workers can perform efficiently?
Sharon, if you go to any, it's a challenge. If you go to each and every state in the country, you can see they have 2, 3 teaching hospitals. It's a structure without manpower. What the essence of that structures? Let them maintain the one they have, and let them provide enough manpower, let them provide equipment, let them provide drugs and all other medical equipment and items on their facilities. Then I think number 2, yeah, we must try as much as we can collectively with our sister union, meaning more especially the family of Jehesu, to come in a strong term jointly to address this issue of inadequate manpower, more especially in our health facilities, not only at the federal government, even at the state level, even at the local government level. We have that challenges. You can go to the primary health center or health clinic at a local government, you will see only one community health officer handling a patient of almost 250 number, which is unaffordable. So I think government should try as much as it can, as I said, to improve the manpower. We have enough adequate qualified health professionals who are yet to be employed, because each and every day they will tell you they have an embargo of employment. Those cadres are there, those professionals are there, but some are even going to run services on casual basis, some on even volunteer. So I think government should try as much as it can to ensure it provide adequate manpower to our health facilities. If they do so, it will address this issue of health challenges in our country.
Thank you very much for your time.
Thank you very much. You are welcome. My pleasure to have you.
And that's all we can take on today's edition of the program. Join us next week for a fresh edition of the show. I am Sharon Ijason. Thanks for watching, and remember that labor creates wealth.